You know that tingling treatment you sometimes get at the physiotherapist's office? Well, today we're going to demystify it. We're talking all about electrotherapy. We're going to break down what it is, how it helps manage pain, and really what its role is in getting you back to moving. So let's dive right in.
First things first, a quick question for you. Have you ever felt like pain is just this giant roadblock in your recovery? It's the thing that stops you from doing your exercises, from getting stronger, from actually healing. If you're nodding along, then you are absolutely in the right place.
And this is exactly where something like electrotherapy comes into play. Now, it's not some magic cure. Let's be clear about that. Think of it as a really powerful supportive treatment. Its main job? To help manage that pain and make you more comfortable, so you can actually do the important active work of rehab.
Okay, so what is this stuff really? Let's get down to the basics. How are physiotherapists using these little electrical currents as part of a healing plan?
At its core, it's actually pretty simple. Electrotherapy is just the use of small, very controlled electrical currents. They're applied to your skin with these little sticky pads. Those are called electrodes. And from there, they can interact with your nerves and muscles to get a therapeutic benefit. It's really a non-invasive way to talk directly to your body's nervous system.
Now, you'll probably hear about two main types, TENS and IFC. Think of TENS as working more on the surface level, really focused on blocking those pain signals from getting to your brain. IFC, on the other hand, uses currents that go a bit deeper. So, a good rule of thumb, your physio might use TENS for a really specific spot, say like tennis elbow, but they might choose IFC for something more widespread, like a general lower backache.
All right, so we're sending tiny electrical currents into the body. But how in the world does that actually stop you from feeling pain? Well, the secret is all about interrupting your body's own communication network.
Let's just walk through it step by step. First, those electrodes are placed on the skin and a mild current is applied. This current stimulates the nerves right in the target area. And that stimulation basically acts like a distraction for the nerve, making it way harder for it to send a clear pain signal all the way up to your brain. And the result? You feel more comfortable, and all of a sudden, moving doesn't seem so bad.
Here's a fantastic way to think about it. Imagine you're creating static on a phone line. The message, in this case pain, is still technically being sent, but all that static makes it incredibly difficult for the receiver, your brain, to understand what's being said. It just scrambles the signal.
So, the big question, how do you know if this is a treatment that could actually help you? Let's go over some of the most common reasons a physiotherapist might suggest adding this to your recovery plan.
So it can be really helpful if you've got musculoskeletal pain that's just making it hard to move. Same goes for those nagging muscle spasms or that constant tightness. It's also a great tool right at the beginning of rehab when pain is usually at its worst, or even during those frustrating flare-ups that can pop up later. Basically, anytime pain is the main thing getting in the way of you getting active, this could be an option.
All right, let's talk about the elephant in the room, shall we? For a lot of people, the whole idea of using electricity for a medical treatment sounds, well, a little scary. So let's tackle the two biggest questions people usually have.
This is it. This is always the first question, right? The thought of electrical currents, even small ones, just sounds like it should hurt. So what's the deal?
And the answer is a very clear no. It shouldn't hurt at all. The whole thing is designed to be comfortable. Most people just describe it as a kind of mild, gentle tingling, or maybe a pulsing sensation. And your physiotherapist is right there with you, making sure the level is perfect and it never feels painful.
And that leads us to the next big question, which is probably the most important one. Is it safe? I mean, anytime you're talking about a medical treatment, you have to know that it's safe. And the answer is a resounding yes, but with one really, really important condition. It has to be applied by a trained and licensed physiotherapist. They're the ones who know exactly what settings to use, where to place the electrodes, and how to tailor it all to you. That professional expertise is what makes it a completely safe and controlled treatment.
Okay, let's zoom out for a second and look at the big picture here. It is so important to understand what the real goal of electrotherapy is. It's an amazing tool, but it's just that, a tool. It's not a cure.
This right here, this says it all. You see, electrotherapy is at its best when it's part of a bigger plan. It's meant to work with exercise and movement. It kind of paves the road so that you can do the real work of recovery.
Because that's the ultimate goal. We're not just trying to numb the pain for a little while. We are trying to reduce your pain so that you can participate more, so you can do those exercises that are going to build strength and create a lasting recovery. It's all about enabling your active rehab. So, I'll just leave you with this final thought. When we use tools like electrotherapy, it helps us change how we think about pain. So what if pain wasn't just a big red stop sign? What if, instead, it was a roadmap? A signal that, when we manage it correctly, can actually guide us on the path to a full recovery. I hope this helped clear things up for you.